Thank you for joining us for our webinar, Getting Community Partners Decisively on Board. We will be starting in just a few minutes. Throughout the webinar, we will be asking you questions via polling pods and discussing your responses, which will be reported only in aggregate. So before we get started, let's practice with a couple of easy questions. You should now see two polls above the webinar title. On the left, please enter the state that you're currently in. On the right, please select the number of people in the room watching with you. If you have any questions or technical issues you need help resolving, please type them into the Q&A pod on the right. We will leave some time at the end to answer questions. Thank you. We'll be back in just a few minutes. Good morning. I'm Derek Hirsch, a project leader with the Rural Health Transformation Center. Thank you to those who participated in our test polls. I'm excited to see that we have an audience from around the country. We have other polls pop up throughout the webinar and appreciate your participation. Feel free to enter questions into the Q&A pod on the right at any time. We'll leave some time at the end to answer those questions. This is the second of 3 webinars in our series, From Sticking Point to Tipping Point. Overcoming Rural Community Health Improvement Challenges. In each of our free interactive webinars, we'll show you how to begin solving a specific rural community health challenge and offer you valuable tools and resources that will help. This webinar is being recorded, and you will be sent a link later this afternoon to view and share it. Now, on to the main event, getting community partners decisively on board. We all know and understand the benefits of cross-sector partnerships, and the recent literature supports the development of those partnerships. But what it fails to do is document the how to getting those partners to the table and agreeing to a shared agenda. Here to share some lessons learned in bringing partnerships together through the Heart of New Ulm Project is Cindy Winters, the project advisor to the Heart of New Ulm Project with the Rural Health Transformation Center. Cindy, the floor is yours.
Thanks, Derek. And thank you, everyone, for joining us today to gain some insights into getting community partners decisively on board a community health initiative. The health issues that we face today are complex, and it takes a diverse partnership to address those issues. So today, we're going to talk about how to get those non-traditional partners around the table and engage in solving the health problems that are being experienced by the community. The literature clearly supports developing cross-sector partnerships, as Derek mentioned, in order to be more effective and efficient in leveraging limited resources in order to address these issues. But what the literature doesn't do is tell us necessarily how to do that. And that's what we're proposing to do today. And I want to give you some quick tips on getting cross-sector partners to the table to create a shared agenda and motivating them to embrace a health initiative. We're going to do that by sharing some lessons learned from the Hardened New Ulm project. In a brief overview of the Hardened New Ulm project, it's a 10-year research demonstration project in New Ulm, Minnesota to decrease heart attacks in the 56073 zip code. New Ulm is a small rural community of about 13,500 people located 90 miles southwest of the Twin Cities. The project began in 2009, and the research portion ended in 2018. And I'm happy to report that the project is still going strong in New Ulm and is being led by a community leadership team and several action teams that are doing the work. So how were we able to accomplish this sustainable model? We'll share some of what we did right and what we didn't do quite right, and would recommend that others avoid doing or doing differently. When the research began, we developed a large steering committee made up of 36 members from the community that attended quarterly meetings. The steering committee was just that, an advisory group that the research staff bounced ideas off of. The staff took the recommendations from the literature and asked the steering committee how those recommendations needed to be adapted in order for it to be successful in New Ulm. But when we started to look at the structure through a sustainability lens in 2012, and sustainability really should be considered from the very beginning, but that's a topic for another webinar, we decided that large steering committee wasn't the right structure. The MHIF staff were doing the work and getting feedback from the steering committee. So in 2012, we began restructuring the local leadership project. It was determined that we needed a smaller, more nimble leadership team. We settled on 12 members that meet monthly to drive the initiative. Today, the Hardened New Ulm project is guided by a 12-member leadership team with representatives from the city, the Chamber of Commerce, the schools, public health, the medical center, and the Medical Center Foundation Board. These 6 organizations have a standing seat at the table. The organizations that have those standing representatives were determined by the steering committee members before they were disbanded in 2013. The other 6 members represent organizations that we partner with or individuals that have the skill set we need to help us think broadly and communicate our work to our target audiences. And then we created action teams that do the majority of the work on a particular issue. Just a couple of examples of those action teams include a Safe Routes to School team, a food environment team, a worksite wellness team, and a downtown action team. We have 10 teams in total. The leadership team members serve on at least one or more of the action teams, to maintain communications between the leadership and action teams. We have over 70 volunteers from 30-plus different organizations or community residents represented on our teams. And this presentation is going to focus primarily on the formation of the leadership team, since this is the group that determines the direction of the initiative, determines policies, and monitors the outcomes. So if you're involved in improving community health work and have been doing it for a while, I'm assuming that you're probably familiar with or have heard of the collective impact and have read or heard about the 5 conditions that support the collective impact model. Today we're going to talk about the first condition, creating a common agenda. With so many different and varied organizations and potentially competing agendas around the table, how do you get to a shared agenda? How do you align your work to create an impact in the community and leverage limited resources? It can be challenging to get all the partners to support or create a common agenda and agree to work together. Now, we have a few polling questions to get you to think about your coalitions and how you go about getting involvement from the non-traditional partners. And those questions are located at the top of the screen above the presentation. We'll give you a few minutes to answer each of the questions as they come up, and you'll be able to see the results as the questions are answered. So the first polling question is, how do you determine who you need or want at the table? And since this is only a 30-minute webinar, we had to make some assumptions. And the first assumption is that you've done your community health needs assessment, you've looked at the data, and you've determined your top priorities. And now it's time to develop a leadership team. We're interested in knowing how you go about determining who will serve on your coalition or leadership team, and how do you determine membership. So the opportunities or answers are by the organization that they represent, personal leadership characteristics, skill set needed by the coalition, their title within the organization, understand their role and responsibility in improving community health, and we don't have any requirements. Right now, it looks like a lot of you recruit by the organization that they represent. And also those individuals that understand their role and responsibilities in improving community health. Looks like most of you at least do ask some questions or have requirements for your coalitions. So Derek, can we move on to the next question? So the second polling question is that if you have a coalition, do you have coalition members that aren't necessarily a good fit on the coalition? And be honest, we're not monitoring or mentioning any names. You know what happens. I've been on coalitions. I haven't been on a coalition yet that didn't have at least one member that wasn't the best fit. And right now it looks like about 46% of you say that you do have a member, 25% say that you don't, and some of you aren't really ready to commit. You haven't decided whether everybody's a good fit yet or not. So it's bound to happen, and it's happened to us as well. And Derek, can we go to the third polling question? And the third one is, and the final polling question is, have you interviewed the coalition members before inviting them to join the coalition or leadership team? And your options are yes, no, don't know, or no vote. And I see about 81, a large percentage of people don't interview their coalition members. All right, so we're going to talk about that and share some lessons learned with what's happened to us when we didn't necessarily interview people. So now I'm going to share lessons learned from the Hardened Yuan project. And city government is a key partner and decision maker in our project because the work that we do to improve the environment, the physical activity. They need to be at the table, that it really isn't all about the organization that they represent, but it's the people within the organization. So the initial city representative on the HANU leadership team was the community development director, which by title makes sense that they're at the table. We're looking at making changes in the community to the design to provide additional opportunities for physical activity. But we soon realized that when it came down to the decision-making processes, they didn't understand their role or responsibility for being on the team. The individual caused the team to have circular conversations that really weren't getting us anywhere. This individual really didn't understand their role in the project or what we were trying to accomplish. It was decided that a different individual from the city needed to be our representative. So the first person was essentially fired. Our new city government employees understands what we're trying to do and can see the vision. And since we replaced that person, we haven't had a circular conversation since. The new representative takes the information back, and the city has come up with some creative ways to bring physical activity opportunities to some of our at-risk populations. We still have some systems and policy work to do with the city, and it can be painstakingly slow at times, but we're making progress. So this not a good fit scenario has happened to us a few times. Once one of our leadership team members just arbitrarily asked someone to serve on the leadership team because we had a spot open and they represented an organization that we thought needed to be at the table. That individual really didn't bring what we needed from their organization to the table. The interview process is so critical in getting the right people around the table and for understanding their skill sets, what resources they have access to. It helps you understand your community better and allows you to view it through a different lens. You really should interview each of the individuals you think should be on the leadership team. The bullet points on this slide are the type of information you want to know and collect. When working with any organization, it's important to understand how it functions, the decision-making process, who the gatekeepers are, and who influences them. It's going to be a little bit different in each setting, so take the time to learn more about the decision-making processes and how to influence them. There's a link to download a potential leadership member survey that has several questions that we've used when we interview potential members. Feel free to add your own questions or change some of the questions to fit your needs. But I want to emphasize that you ask the questions of everyone, regardless of whether you think you know about the organization or not. Maybe the answer will confirm your knowledge, or the answer might just surprise you and provide you with some additional insight. I think a lot of times we have a tendency as facilitators and as coalition leaders to not ask a question of your community because as a member of your community, you think you already know the answer. And I think we're selling ourselves short when we do that, and we really need to ask those questions even if we think we know the answer because, like I said, the answer could very much surprise you. And when you are asking these questions and leading your coalition meetings, it's vital to be an active listener. You don't want to be thinking about how you're going to respond to what they're telling you. You want to reiterate what you've just heard to be sure that you understood it. If not, ask them to explain it differently. Understanding what motivates your partners, whether it relates to health or not, is critical to bridging the gap between your organizations. It's our job to take what motivates them and wrap health around it and show how health supports their motivations. Figure out how your work can help or complement their work. Now I'd like to introduce you to Audra. She's the former Chamber of Commerce president in Yuan. She was one of our first recruits to the steering committee and remained as a member of the leadership team. In the beginning, she didn't really understand why we wanted her at the table. What role did she have to play? But as the leadership team began to gel and we provided some training and networking opportunities, she understood. and became one of our strongest advocates. This picture was taken when a health system came to Yuan to help them understand and learn more about the project firsthand. Spoke to them as a representative of the leadership team and provided them with these takeaways when working with businesses. You need to understand your key stakeholders. Do put it in economics, profit and loss, employee recruitment speak. In too many companies, wellness is thought of as fluff and designated to the social committee. It should be seen as a strategy, so learn to talk about it differently. Do translate public health ease into business language. Do be teachable. Get excited about the business, products, or services that they provide. If you can't, then you shouldn't be their contact for wellness. And do engage business champions. Don't pull the obligation card. You should care about this. And this is a quote from Teddy Roosevelt. People don't care how much they know until they know how much you care. And then Audra's last Audraism, as we call them, is if you can't answer the why question in a way that they can understand and embrace, you need to spend time on the relationship. Audra was always good about calling us on our use of public health speak. She would stop the conversation and ask us to put it in her language so that she could take it back to her constituents. So once you have your team pulled together, you need to do some foundational work that will pay great dividends in the long run. Many times we rush into doing the work of the coalition and solving problems. But we need to build the team and create that sense of cohesiveness. The team needs to speak the same language, and there's several ways to do that. A couple of ways that we have done it is to create a vision board. At one of our meetings, we provided the team with magazines and asked them to cut out pictures of what they envisioned Yuan would look like as a result of their work. Once they cut out the pictures, they explained why they chose that particular picture. Then those pictures were used to create the vision board. This board is displayed during our monthly leadership team meetings and explained to new members as they join the team. We also recorded the words being used to describe why they chose the pictures and used those to create a word cloud. And this word cloud was also shared with the team members and became a part of the vision board. This all may seem like fluff to the worker bee that wants to jump in and get things done, but many coalitions tend to overlook this work. I was at the Association for Community Health Improvement Conference in March, and one of the presentations touched on this point. There are important relationship building blocks. These are important relationship building blocks for your team. The team's going to have to make some difficult decisions and challenging discussions in the future. And so understanding where the team members are coming from in these discussions really helps inform the decision-making process. And in order for the leadership team or coalition to function effectively and efficiently, you need to build trust among the members. Decisions and the speed of your progress is dependent upon the speed of trust. And trust is the glue that holds the team and coalition together. Building trust takes time, and it doesn't take any time at all to destroy it. So once you've worked to build trust among the members, you'll be amazed at the amount of progress that you'll make. It's vital to maintain and nurture that trust and respect among the members. So these are the 8 basic principles of practice documented in the collective impact literature. And it's critical to build a culture that fosters relationships, trust, and respect. We use the acronym CASH, C-A-S-H, to describe the building blocks of the coalition. C stands for connect. Get to know the team members on a personal level. Do quick opening icebreakers, asking members to share their favorite vacation, hobbies, colors, etc., something personal about them. It's much harder to say no to someone that you know on a personal level than someone that you don't. A stands for autonomy. Create a safe environment where members feel comfortable sharing their opinions and thoughts without judgment. What is said in the room stays in the room. S stands for skill building. provide opportunities for personal development, and build their knowledge base on the issues being addressed. And H stands for healthy norms. Develop norms of how the group will function, what it will allow and not allow. Set ground rules and basic decision-making procedures. And as I said before, this work is complex and challenging. This is one of my favorite pictures. I have a wood carving of it in my room that a client made for me. It speaks volumes for this work, and this saying was recently sent out to all of the staff as a motivational message. So don't be afraid to make a mistake in this work. Yes, it's disappointing to make mistakes, but it's also an opportunity to learn and understand. Take the time to step back and figure out why it didn't work and make the appropriate changes. Sometimes it's all about timing as well. Perhaps that wasn't the right time, but don't dismiss the opportunity to learn from your mistakes. So if you fail, never give up, because fail means first attempt in learning. End is not the end. Effort never dies. And if you get no as an answer, remember that no means next opportunity. So this is my contact information if you'd like to know more. We'll also have a link to our website and a link to register for an upcoming webinar on moving the community from buy-in to ownership. Thank you for your time and attention, and we love sharing our lessons learned. So we have some time for questions. Derek, do we have any questions in the Q&A?
Yes, and thank you to those who have been sending in questions. The first one, how do you avoid alienating community organizations when interviewing and not selecting their staff for your leadership team?
I don't know if that's a good question, and I don't know that it's maybe their staff person unless it's a really small organization, but I think it's finding that right person within the organization. I think it's working at the local, I've worked at the state level, and it's much easier at the state level because you're already working with the community champions. They've come to you and want to learn. At the local level, it's harder, and you have to spend a lot of time really trying to find those local champions. And if you don't choose someone from their organization, that doesn't mean that they cannot get involved. And I think it's important to let them know that you'll keep them informed of what's going on, and there may be an opportunity to participate perhaps on an action team later on.
Thank you. Our next question, what if your initiative is spread over several communities? Would you have separate teams for each community?
That's a great question, and I've had people ask me that before, and I think it depends on the distance between your communities, how closely they perhaps work together. I would probably start having separate leadership teams in each community, and then as the work progresses and if there seems to be a lot of overlap, then I think it would be an opportunity to maybe meld a couple of your leadership teams, or at least have some crossover between team members. But initially, I believe it's important to have separate ones to start out with.
Thank you. And another question, how do you get school district engagement? And how do you get provider primary care buy-in?
I think those are excellent examples of why it's so important to sit down with people within the school district and do an interview and really find out what motivates, what are school districts looking for, what motivates them, why would they ask why they participate in other coalitions, what is it that they need to get out of participating. And then you can start reframing your message around their motivations and how your work can support what they need to get out of the coalition. That's what's really key about coming up with that shared agenda and building that foundational work. Our school is a key member, and they are involved because they know that physical activity really helps to increase test scores and decrease behaviors. And if you can share that with them and look at the data and the research that shows that around health, then I think you have an opportunity to get them on board and have some buy-in with them. But it takes sitting down and talking to them and learning that about their organization. And I think that's also true with provider and primary care. And it may not be the first person that you talk to. You may have to talk to several before you find that key influencer. And even if you can't get that particular person on board, if they have the ability to influence someone that you want on board that maybe hasn't bought in yet, I would tap into that individual to help them. If they see what you're trying to accomplish, help them influence the person that you want on board.
Thank you. Our next question is, sometimes it seems like there are many community initiatives. One group is trying to work on housing, another on mental health, another on education, another on chronic disease. What's the best way to improve visibility among partners involved in all of these separate initiatives?
I think that's probably really common in a lot of communities, and that's where our sustainable leadership model has really come into play, is that I would meet with each of those groups and see if there's one individual that would be willing to serve on an umbrella leadership team that can take the messaging back to those individual coalitions. And because there's got to be a lot of overlap in the work that's being done, and there's probably an opportunity to decrease duplication of services, to better leverage resources if they maintain a level of communication and coordination across the community and really start to work better together than in their coalition silos. So I think it's an opportunity to build that umbrella leadership team, and those coalitions then report with or stay in close contact with that leadership team so that the work really appears to be coordinated across the community and it becomes more a full community effort.
Thank you. One more question here. Without ruffling any feathers, how do you get someone who is not a good fit for the coalition to step down?
That's a great question, and I've had to do it more times than I care to admit, but I think as a staff person, it's probably harder for you to do it. I would tap into my volunteer base and talk to some of the other members of your leadership team and come up with a game plan. And maybe it's just one of the other leadership team members talking to that individual and saying, you know, it just doesn't really seem like you are buying into what we're trying to accomplish at this point in time, or what are the barriers for you understanding the roles of your organization within this team. And that way it really feels like it's coming from the community and not necessarily from the organization that might be housing the coalition. That's one way of looking at it, or
Thanks. And on the flip side, what if you can't get the person you really want from an organization to join the coalition?
Then I think that's when you really find out or try to determine who influences their decision making. Who do they go to for information? Who has their ear? And talk to that particular influencer. And it may be that you don't have, if you want an individual on your coalition but they don't have the time, that doesn't mean that they can't act as an advisor that you can meet with separately, keep them informed of what's going on, maybe send them meeting minutes, and then touch base with them on a regular basis to say, hey, this is what's going on, this is the direction that we're thinking about going, what are your views on that, would your organization be supportive, and what role could your organization play in that?
Thank you, Cindy. And that's all the time we have. If you'd like to say a few more words, and then I have some housekeeping items.
Nope, I just want to thank everybody for their time. We are going to have another webinar talking about switching coalition work from buy-in, which means when people are participating, to actual community ownership. And that next webinar is on July the 10th, and there is a link to register for that just above the presentation. Thanks, Derek, and thanks for everybody for joining us today.
Thank you, Cindy, and thank you everyone who was able to join us live. You can get more information about the Rural Health Transformation Center and access all of our tools and resources via the link in the pod just above the presentation. And while you're up there, as Cindy mentioned, you can register for our next webinar, which is titled Helping Leaders Move from Buy-in to Ownership, which will be on Wednesday, July 10th from 11:30 to 12 p.m. Central Time. Cindy will also be hosting that. And if you have any additional questions or would like more information, you can email Cindy directly, or you can email us at populationhealth@mhif.org. Lastly, we would appreciate your feedback via survey, which will pop up right after this webinar. And once again,